Okay, but we can wait a little bit. Hey, now hello and welcome everyone. Good evening to the Regen Rx Academy. I'm Dr. Joyce Martin,
And I'm Anthony Spardello.
family nurse practitioner. Anthony's a holistic registered nurse, becoming a family nurse practitioner. And tonight we're going to look at hair restoration through a whole person protocol driven model. At Regen Rx, our guiding statement is we don't treat hair, we treat the whole person. So what I'd like to do is have you guys, if you can, just introduce yourself, tell us where you're from. So I don't know about you guys, but today the rain was torrential downpour in Rhode Island. It was crazy. Anthony, you had a rough ride in.
It was going so fast, the windshield wipers couldn't even keep up. Everyone's doing 20 on the highway.
Oh my gosh. Yeah, crazy.
Mhm.
I was lucky enough to have to move all of my furniture out of my hardwoods because they're getting redone. So that was a crazy evening and morning. But you know what? I survived it, and coming to work was just my happy place after
That's
all
right.
of that, I'll tell you. But anyway, so well, you know what? It stopped raining now, and I guess the flowers needed it.
That's it.
Hopefully we're going to have a sunny weekend. Last weekend was so beautiful.
It
Really
was.
beautiful. Cool. All right. How was your ride home? Not too bad?
No, not too bad at all. Wasn't too
Okay,
bad.
great.
Rained for a little bit, but it's good now.
Okay, wonderful. All right, everybody, welcome. So please introduce yourself in the chat. Let us know where you're from. We're excited.
Yes, welcome here, and I hope you're going to go home with some valuable information and keep coming back for more, because I think you're going to like what's in store for tonight for you.
Yeah, it's going to be really great. This is our third masterclass. So excited about that. And, you know, things are evolving. Anthony and I, with our team, we're just talking. I just got a text from a friend who's very research oriented. And not only do we have so many things that we can fit into a customized protocol, but he has some research, believe it or not, on gummies. And not that cannabis is bad, but they're not even related to cannabis. It's actual gummies that can restore and help regenerate hair. So I'm just so excited about that. I can't wait to dive into that in the morning and look at that. So things just evolve really quickly. And Anthony and I are givers. We love teaching. I was an assistant professor teaching nursing for a little bit, and now I just got busy kind of with my own thing, but I enjoy helping people it got to a point where I had a lot of nurses actually as patients, and they're like, "You got to teach me what you do," and that's kind of how this really kind of all evolved, really. So it's pretty exciting. Where Anthony and I started, we're at Biomed New England in Providence. They've since closed, and they actually modeled after the Paracelsus clinics in Switzerland. So we're really excited to even bring some European traditions and protocols to our center here at Regen Rx and our academy. Something pretty cool is we're opening up third location. Can't believe it, but things happen for reasons, and that's going to be even more and more exciting just to help more and more people, especially practitioners. So like I said, we're just givers, and we do this because out of the love of just helping one another and helping people.
Yes, we love what we do, and we try to give back as much as we can.
Yeah, for sure. So this will be a great evening. It's funny because I just closed on the building, and my attorney said, can you do anything for my hair? It's thinning. Even men just, it's horrific for women, but even men are just like, I just don't want to lose my hair. So if we can help people, it's wonderful.
That's right.
All right, we're going to start with our presentation. So again, good evening, everyone. Welcome to the Regen Rx Academy. This is just a love of both myself, Anthony, and the rest of our staff. Tonight, we're going to look at hair restoration, regeneration through a whole person protocol-driven model. So I love this statement, and we go with this. We don't treat hair, we treat the person who lost it. Yep. And in a very comprehensive way. It can be, the loss can be from genetics, hormones, illness, inflammation, nutrition, medication, stress, or even scalp health, and even traction. The way people are wearing their hair, even from childhood. So when we begin with a syringe or a device before understanding the patient, we're missing the drive, what's driving the problem. So we're going to move through recognition, assessment, optimization, treatment, measurement, and maintenance. The goal is to help we want you to ask better questions, and we want to answer them. We want you to be able to select your patients carefully and build an organized plan rather than offering isolated treatments.
Yep.
The program is for practitioner education. Every decision must be adapted to patient presentation. The provider's scope, very important, in training, and you must check your state policies and regulations, clinical policy, and applicable regulations.
Yes.
So I want all of you to feel free to say hello, your name, and put that in the chat, because we really want to get to know each and every one of you. So I promise for the masterclass tonight, I want you to see hair restoration as a clinical system rather than the single treatment. You're going to get more patient retention, and they're going to trust you. Before recommending the therapy, we need to recognize pattern, the likely pattern, understand their timeline. When did this happen? Was it, a month ago? Was it 3 years ago and they're just coming now? Identify some warning signs and determine the candidacy. It's not for every single person, but it is for most. The protocol connects the consultation, the whole person optimization, treatment selection, objective measurement, and then the maintenance. Every step has a purpose and leads to that planned reassessment. Reassessment is very, very important. This is never a one and done. We will also discuss premium positioning. Premium care, it's not charging more money. It's creating the value through education, structure, follow-up, and accountability on both sides, the patient and ours. When patients understand that you're guiding them through a measured plan, the conversation shifts from price comparison to trust. The transformation is moving from, I can do a PRP, to I build individualized regenerative hair protocols. A procedure's an event. We don't want just an event. We want that protocol to be a roadmap for our patients. I want you to remember the phrase, protocols out outperform procedures.
Yes, that's very important. Protocols outperform procedures, which you'll learn a lot about tonight. So just getting into tonight, what we're going to be going over, we'll name some common challenges that a lot of practitioners can find in their own practice, especially when it comes to hair restoration, and why many practitioners experience that hair restoration feels like a series of appointments rather than a complete clinical program for most of your patients. The main portion of this is going to cover Regen Rx's framework. We're going to recognize patterns. You're going to obtain a story and optimize the terrain of the actual patients and what's really going on at a whole body level of the patient. We're going to introduce something called the Roots framework, and we'll go over that shortly. We'll review any kind of red flags to any treatments, things like that, and discuss any clinical laboratory evaluations, examinations, and things like that. So when it comes to patients, they come once and never return. I'm sure many of you have dealt with this in some of your practices. Many practices offer now hair restoration. So the patient experience with that hair restoration still kind of feels fragmented and all over the place. A patient schedules one treatment, they come in, they know what it may be being used for. They receive kind of limited education on what the treatment's going to do, the actual expected outcome of the treatment, and such forth. And they leave without really understanding what happens next. What now after I've had this treatment? What do I do? Do I do anything at home? Is the provider going to just hold my hand throughout this? What happens? And that can be very frustrating for your patients. But they want answers, and they do want you to be their advocate as well. So when the service becomes commoditized, that's when we see a problem. When PRP is presented as a one-session treatment, for example, patients compare it with every other clinic that does PRP. The question then becomes, how much is PRP at this clinic or this clinic or this clinic, rather than which provider, has the strongest assessment and treatment plan for me with my goals in mind as well. So technical skill alone does not create a premium experience for the patients. A provider, you may perform your procedure exceptionally well, but the consultation may lack something, or your team language, or the follow-up with these patients may be lacking. And that could be also a reason why these patients feel like scared in a way, scared or uncertain, and they cannot sometimes not return to the center. So the central message with this is fairly simple. When you sell treatments, patients compare the price, and they get scared, they get uneducated is the best way to put it. They're uneducated in what exactly they're getting, and is that going to be the best for them? Should I go with this clinic because they offer it at this price, or should I go with this clinic because it's this other price? We want to avoid that completely. When you present a thoughtful plan to your patients, the patients now, instead of comparing cost, they're comparing trust between these other practices. When your patients trust you and you have their best benefit in mind, and you give them a thoughtful, creative, and individualized care plan, and not just a one treatment, that's when that trust grows. That's when we see patient retention. So trust goes when the patient feels heard, as we know with anything. Understanding the suspected pattern, that what they're going through, or what they're going to be going through for treatments. They see the sequence in the treatments that they're getting, and it makes sense to them. And they know that their progress will be measured. That's huge, measuring the progress. And we will go over some ways how we can measure the progress with hair regeneration specifically.
Perfect. Okay, so this slide shows the progression from a procedure to a complete system. A procedure is one appointment and one intervention, often without a defined next step. A package adds several sessions, but it may still be repeated procedures without a clinical reason. Protocol connects assessment with the sequence. Patient receives a consultation, a working pattern, foundation optimization, selected treatments, and planned reassessment. Each component individually has a purpose. A system adds standardized measurements, maintenance, and team consistency. The patient understands what happens if the response is strong or limited or absent, and every team member communicates that same roadmap. So instead of answering only how much is one PRP or one stem cell treatment, the provider can explain, based on your pattern, history, scalp findings, and goals, we recommend a structured plan with specific checkpoints. The patient is buying our leadership, organization, and not simply time in a treatment chair.
Exactly.
So what we're doing is we're guiding the patient, we're being organized, and we're planning for a follow-up with them. The Regen Rx philosophy is organized around 4 actions: recognize, optimize, treat, and measure or sustain. These actions keep the procedure from coming before the patient. First, we recognize the pattern and know when a referral could be necessary. Second, we optimize the terrain by reviewing relevant illnesses they may have, what medications they're taking, their nutritional status, weight changes, especially with the GLP-1s, stress, sleep, hormones, and scalp practices. Optimization is individualized. It's not the same supplement plan for every person. Third, we treat strategically. We select the smallest responsible intervention that fits the biology and their terrain and their patient goal, or goals with an S. Options may include foundation care, topical or prescribed or directed therapy, PRP, could be umbilical stem cells, microneedling, light-based adjuncts, or a combination of any of them. Like I said before, and I began with, it's customized to the patient. More treatments is not automatically better treatment. And we can't forget what I started with, the X-Stress gummies. I can't wait to dive into that research tomorrow morning. And like I said, I don't know if everybody was on yet. This research is constantly changing. I mean, we're getting new information every day. So it's really exciting, especially for us to be able to share it with all of you. Finally, we want to measure and sustain. We want to use baseline photography. I use a double check system, always 2 cameras. God forbid something happens to one. Planned reassessment, adherence review, and maintenance. When a patient's not responding, because it can happen, we reassess the pattern and the plan rather than automatically adding more sessions. We look elsewhere. We just peel back and we look at it all over again. We support viable follicles. We do not promise to create follicles when none remain. However, in the current research, with certain things that we can do, we can stimulate follicles, which is really very, very, very exciting. So this philosophy, it really is life-changing for most. This philosophy guides every later treatment decision.
Yes. So this is one of my favorites. Why Hair responds to the whole person. So that's what we have to look, especially from a holistic model, the whole person, not just what's going on with just the head or the scalp. So a hair follicle, as we know, is a metabolically active tissue, and it's influenced by many factors: circulation, inflammation to the area, hormones, stress is a big one. Any kind of cellular signaling, there could be cellular signaling problems, and nutrition as well. That plays a big process in hair follicles. So microcirculation supports the tissue surrounding that follicle. Inflammation, scale, tenderness, or active scalp disease will interfere with the follicular environment. And it may also signal that diagnostic evaluation may be needed before you do any kind of cosmetic or aesthetic treatment on that.
Mhm.
So hormonal factors can influence progressing or shedding. Androgen sensitivity, any thyroid changes, menopause, polycystic ovary syndrome, postpartum shifts, and stress-related physiology may all be relevant. So the goal is not to become an endocrinologist, of course, during this aesthetic visit and consultation with the patient, but it's to recognize that there's a whole lot of different things playing into what's going on. And do I need some kind of further evaluation with this patient, whether it's either in your office or a referral to endocrinology or anything like that? And that collaboration, physician to physician, peer-to-peer collaboration when necessary. So PRP and controlled stimulation interact with living tissue. They don't overcome every diagnosis. The thing to remember is the scalp does not respond to force. So if you just throw everything at the kitchen sink in it, it's not going to respond well. It responds to the environment, particularly.
Mhm.
So more needling, injections, or products don't automatically mean you're going to have a better outcome for your patient. You have to look at all this from that whole person and really see what's going on. So the roots framework, as I was discussing before. So roots is an operating system, so to speak, that we use for this masterclass and in our theory and philosophy of Regen. So R stands for recognize. Recognize meaning you're recognizing a pattern before you're recommending any kind of procedure or treatment. The first O is obtain. You're obtaining a history on your patient, a timeline. So any onset, when did that start? Any family history, this is particularly important. And then also any illness, underlying illnesses, medications, what are they taking for meds? Supplement use, that's a big one too, to see what they're using for supplements. And then of course their stress level, nutrition, as we said before, any scalp symptoms going on. And then their styling practices. This can come into play, and a lot of the times we won't think about this. So hair products or even styling practices that they're using could be causing strain and stress on those follicles. The second O, optimize. So what we're doing here is we're optimizing the relevant contributing factors that may be present. This can include the scalp health, the status, the patient goals that they're looking for before and after treatment, and the risks of the treatment and tolerance. How's your patient tolerating the treatment? The S is sustain. Excuse me, I skipped the T. The T is treat. With the layered strategy, and you're going to learn that layered strategy. So we're going to treat our patients with a layered strategy. And what that means is we're using a working diagnosis, a viable follicle. We have the patient goals, risks, all discussed. And then we're going there ahead with the treatment. And then last, S, sustain. So measure, maintain, reassess. Sustain your patients, measure your patient outcomes. A huge way for patient outcomes with your hair regeneration, photos. Make sure you're doing photos before treatments, during each treatment, and then after the treatment. So you want to have these baseline to go off of and then see how well your patient is progressing. So this sequence prevents that impulsive kind of treatment decisions that either as a practitioner or a patient may be advocating for. Any kind of treatment that really impulsive and may not go along well with the treatment plan. We want to have this framework because we know using this will give a better outcome with a treatment plan with the patient. So it gives the provider, the patient, and your team very common knowledge that you all will be on the same page when it comes to treating your patients. So if you only remember 5 words, or 5 letters even tonight, remember roots. Recognize, obtain, optimize, treat, and sustain.
No pun intended, roots. I love it.
Yep.
All right. All right. And, getting back as a functional medicine provider as well, I like to tell people it's very important when we're checking hormones. You know, if we want to check the thyroid, we're not just looking at the TSH. There's way more involved. And we call upon a compounding pharmacist to help us with what we want to be ordering often. And so we have a whole collaboration that we can share at a later date with you on that. But that's really, really important. You know, so many people come, oh, my hormones and my, you know, we're not poo-pooing the GYN and the OBGYN, but they're not specialists in hormones. So functional medicine does play a little bit of role in that, and we can help with that as well. So getting back to the hair loss as a clinical finding, it is not one diagnosis. Before treating, we need to classify the general pattern. Pattern hair loss usually develops gradually. Frontal first, temporal, vertex central part or crown thinning, and progressive miniaturization. Telogen effluvium is commonly presented as diffuse shedding after an illness, childbirth, surgery, rapid weight loss, diet changes, medication changes, or major stress. And the patterns, it's not only one, they can actually overlap. Alopecia areata may appear as a sudden smooth patch and require medical intervention. Traction and breakage call for very careful review of tight styles, extensions, chemical processing, heat, and repeated tension. Inflammatory or scarring signs are the safety category: burning, itching, pain, pustules, scales, loss of that visible follicle opening should make the provider pause for a moment. Yes, can we regenerate a follicle? But it can be a little tricky, but it can be done. The provider doesn't need to force a perfect diagnosis during the first consultation, but must determine whether the presentation resembles a common non-scarring pattern, need further workup, or contain red flags. Before PRP, stem cells, microneedling, laser cap, or anything you're doing, we need to know, does this patient belong in a regenerative program today?
Yep.
Honesty is always the best policy with our patients. That builds trust and they appreciate it.
They do.
So, when advanced care meets do not treat. Advanced care includes knowing when to perform a procedure or even to put them on a program. Persistent burning, pain, marked itching, scalp tenderness, they're all warning signs. Pustules, crusting, bleeding, inflammatory scaling may indicate infection or an inflammatory disease that should be diagnosed or stabilized first. You may not lose the patient, they may come back. We have to take care of the patient first in the appropriate way. Loss of the visible follicle opening is concerning. A smooth, shiny, or scar-like scalp may indicate scarring process. Rapid focal loss, even looking at their eyebrows, or unusual patches also deserve further evaluation first. The action sequence it's pretty simple. You're going to pause, you're going to document, and then you're going to refer. Always doing the right thing for our patients. Photograph the findings, of course, record the symptoms and the examination details, explain the concern without creating unnecessary alarm to the patient, of course, and recommend that appropriate medical intervention. Referral doesn't mean that you're losing the patient, like I said in the beginning of the slide. It demonstrates proper clinical judgment. It protects the patient, the provider, and your whole practice and staff.
Yep.
After diagnosis and stabilization, supportive care may be or may not be appropriate. The safest practitioner is not the one who treats everyone. It is the one who knows who should not be treated today.
Yes, that's very important. And with that, we'll have a little wow case here. So this is a case for everyone, and it's almost like what would you do? So we have a 45-year-old woman with some frontal recession, eyebrow thinning, itching and burning scalp, and some follicular openings that are difficult to identify. So, what should be our first move in here? Maybe a series of PRP, some microneedling, a topical stack, or pause and evaluate or refer. With this, have your questions. Grant benches the floor friend. So let's see what we have going on here. Burning and itching. Apologize for that. That went a little bit. There we go. So burning and itching. What does that first say to us as burning and itching? Could be some kind of infection, fungal, not too sure, but that burning and itching really isn't normal there for that scalp.
Correct.
So it doesn't fit your routine cosmetic kind of thinning, only because that frontal recession, that itching and burning scalp. The eyebrow involvement's also pretty interesting there, and it's difficulty identifying that follicular openings raise the concern for possible scarring to the scalp as well. So a cosmetic procedure could further worsen irritation that's already on this person's scalp, on this patient's scalp. We can complicate a clinical picture that we're trying to now obtain. We can even skew any future kind of treatments that we're going to do if we were to rush and treat this patient right away. So the best thing to do would be to delay treatment with this. So a respectful explanation, because a lot of times this is going to happen. Your patient's going to come in, they're going to say, I came for this. Well, why can't I have it? And what's the reason why? So a good explanation would be, as a provider, you're seeing features, you're seeing symptoms that exhibit something that deserves a kind of consultation by dermatology before we perform any kind of regenerative treatment. We want to make sure that what we will do here isn't going to interact with what may be already going on or worsen. So we want to treat the correct condition and protect the follicles that you already have, the healthy follicles there. That avoids any kind of diagnosing beyond your scope as a practitioner, but it clearly explains this delay. It's not only because you're unsure of what's going on, but you have your patient's best interest at heart. You're referring them to get what is going on outside of this coming in for the treatment for the hair regeneration, and you want that taken care of before the patient comes in.
Mm-hmm.
Because like I said, you have their best interest. That's why you're a provider, and that's why you're into this. You love your patients, and they're going to love you for that and for that honesty. So again, having your patient's best interest and nurture them. You got into medicine. You got into medicine to teach and to heal people. Nurture your patients and help them the best you can.
Mm-hmm.
So step 2, obtain the story and to kind of optimize the terrain that you and your patients are all working in. So once red flags have been identified and now been excluded, if there were any, obtain a story first. Obtain a story from the patient. See what's really going on, and start with that timeline, not just the treatment right away. Ask what changed 2 to 4 months before any kind of shedding began. Consider any illness within that time, any underlying illness, autoimmune disease, childbirth or surgery, any rapid weight loss, especially your patients on those GLP-1s, excuse me, diet changes, any kind of new medication change or new medications, or major stress. We know that stress plays a huge role in hair follicle. So ask about stress. Most of us have it, but see what level of stress your patient is under. And then ask about that itching, any burning, scaling, chemical kind of processing extensions that they may have, tight styles, heat, as Joyce was saying before, that all ends up putting stress on the hair and on the follicle itself. So optimization really means addressing the contributing factors connected to this whole presentation that we're doing. It may involve the scalp care, It may involve nutritional care. It may involve hormone, not replacement, hormone monitoring, possibly hormone replacement therapy. Medication review. You want to make sure supplement review as well, like I said, and collaboration with the patient's primary health or any other specialty doctor that they may have. Now, I know what you're going to say or think. Primary care, westernized medicine, they may not know all of this and it's very gibberish to them. It is true. A lot of practitioners on conventional medicine may not know this whole regenerative side to it, but I've been finding more and more, a lot of them are more willing to discuss their own patients' best interest and their treatment plans with providers that are in regenerative medicine, in biological medicine and things like that. So if needed, we could always refer those patients to endocrinology, women's health, dermatology if needed, or nutritional professionals as well to see if that's a problem.
Perfect. Okay, so the Regen Rx standard is story-driven laboratory evaluation, not indiscriminate testing or random supplement sales. Tests should be selected because the history, examination, or pattern makes them clinically relevant. So for instance, when we do hormone evaluation, I always do a Dutch test, modified or complete. I feel it gives us a real clear picture on what the patient's hormones are doing, and that can obviously contribute to hair loss, thinning, shedding, and whatnot. Depending on the presentation, evaluation may include CBC, ferritin, iron studies, thyroid testing, the comprehensive thyroid testing I alluded to, not just a TSH, metabolic studies, vitamin B12, folate, vitamin D, zinc, or review of protein intake. These may be especially relevant with diffuse shedding, restrictive eating, rapid weight loss, like we said with the GLP-1s. That's been very, very prominent lately. Malabsorption or bariatric surgery. Hormone evaluation, we want, like I said, that to be selective. We also want to know, do they have irregular menses, acne, hirsutism, menopause, or a sudden pattern change may justify further evaluation or collaboration within the scope. Laboratory testing does not replace scalp examination, a dermatological referral or evaluation, their culture, a biopsy when inflammatory or scarring features are present. Avoid rigid universal thresholds. Results must be interpreted in the patient's clinical context by an appropriate qualified provider. Testing should answer a clinical question. Otherwise, it may create expense and confusion without improving care. So the take home is this slide teaches rationale, not universal laboratory rules. Hair restoration is clinical, but it's also deeply personal. Patients may describe this thinning in factual terms, while the emotional effect appears in their daily behavior. Some are avoiding crowds in waiting rooms. They want to come early for their appointment. They don't want to be around people. They don't want to be in their family photos, bright light or activities that expose the scalp. Others rely on hats, scarves, fibers, or the same hairstyle to conceal an area that makes them feel very vulnerable. Many say, I don't feel like I myself, and that's sad. And we can help those people, which is beautiful. That experience should not be dismissed as vanity. Hair can be connected with identity, age, culture, femininity, masculinity, health, and confidence. Ask what concerns the patient most, what they have stopped doing because of it, and what meaningful improvement looks like to them. These questions help reveal expectations and the outcome that matters most. Empathy must still be paired with honesty. The more distressed the patient feels, the more carefully we should explain limitations, timelines, alternatives, and uncertainty. The scalp is part of that patient. It's not separate from the patient.
That's right. Okay, so here we have another interactive case. I promise there's no trick questions to this one. This one will be rather straightforward. So we have a 52-year-old woman here, gradual central thinning, some increased shedding after a diet change, mild scalp scaling, and a strong family history of some thinning. So what would be the next step? Some immediate PRP, a universal supplements tack, no treatment at all, or refer, or a full assessment part followed by a layered plan. The best answer is a layered plan. So the gradual central thinning in family history suggests female pattern hair loss. The increased shedding after a diet change suggests that there may be a possible telogen effluvium component, which is hair loss during the telogen phase or the resting phase of that hair follicle. More than one process seems to be occurring or going on here. So the plan may include confirming this pattern, clarifying the diet and weight loss timeline, reviewing any kind of protein intake or daily nutritional intake, what they're having for meals, selecting a relevant laboratory evaluation and tests to go along with your diagnosis, and then treating the scalp condition. And of course, documenting a baseline on this, discussing any medical, topical, regenerative, and maintenance options too that may be available to these patients. So PRP may come later as a later part of this plan, but it should not be the first one. And it should not be your only kind of thought, even after down the road of this patient treating. So the case shows why these protocols have greater value than your isolated procedures. And they allow us to address those overlapping drivers in that the correct sequence to best treat the patient as well. So treat the follicle strategically. Treatment is a ladder, not a menu. A menu encourages choices, isolated choices here and there. But a ladder explains why each level exists and when to reassess. The foundation is the working pattern here. Trigger identification, scalp health, nutritional stress and sleep, and medication review, what we've been talking about and stressing. Next are any topical therapies, such as 82M, which is compounded by Dr. Bauman, who is a hair specialist as well, doctor, or the oral kind of dose options that are available too. And then scalp-directed care when appropriate and tolerated for your patients. Prescriber-directed options may include finasteride, dutasteride, spironolactone. Those require individual counseling, though. Don't just right off the bat start to go for those options. They require individual counseling with your patients, risk assessment on those as well, and monitoring by, of course, you as the qualified provider or your prescribing provider or physician. So regenerative options will include your PRP, your microneedling, light laser treatments as well. The light-based adjuncts and other adjuncts may be added when your patient is now appropriately ready to be treated for those. We got to get them there. Think of that ladder. And of course, I can't stress this enough, photography. Make sure you're doing photography with all this before, during, and after. Adherence checks with your patient, especially if they have any kind of at-home treatment that you're giving them. Make sure they're adhering to the plan for that and following those prescribed directions with that. And then, of course, plan your reassessments with these patients. And then any adjunct or booster treatments that may be necessary. So every provider should answer 3 questions. What am I intending to improve for this provider? Intending to provide and improve for this patient. Why is this patient a candidate? And when will we decide as both a provider and a patient whether it's working or not? You want to get your patient's objective information all the time. Every single time you're following up with them, see what's going on, what's working, what's not for them.
All right. So what does PRP actually do? And it doesn't say it on the slides, but also the latest and greatest umbilical cord stem cells, which I am so happy that now laboratories here in the US are now FDA registered. So this has been a big win. And we're using them all across the board in different aspects, which is pretty exciting. So the PRP and the stem cells, sometimes that's described as like a hair fertilizer, but that language can create unrealistic expectations. Like it's not a one and done. So a more responsible explanation is that PRP or stem cells uses a concentrated portion, well, PRP, the patient's blood, because the umbilical cord stem cells is obviously donor. And this delivers signals, cell-to-cell communication to the living tissue. These signals support processes within the follicular environment, including tissue communication, microcirculation, and the hair growth cycle. The key phrase is may support, but most often does. PRP does not create new follicles. The stem cells can, where the structure is no longer viable. It may support miniaturization or weakened follicles in selected non-scarring conditions, which is why candidacy does matter. A useful patient explanation is PRP and the stem cells use signaling PRP from your own platelets, and it supports the environment around the follicle that are still present. It cannot guarantee regrowth or recreate follicles that are gone unless you're using the stem cells. So we measure your baseline and use it as part of a broader plan. PRP may complement topical therapy as well as stem cells, prescriber-directed care, scalp treatment, and foundation optimization. It supports the plan. It is not sold as the entire plan. Again, we're customizing each protocol for each patient individually, obviously.
Yes.
Okay, so practical clinical guardrails. PRP protocol begins with a candidate. Are they fit for this procedure? The patient should have a likely non-scarring pattern, viable follicle, realistic expectations, and no activity or inflammatory red flags. Before treatment, review all the medications, the bleeding risks, of course, the photos, the consents, is there any discomfort, variable responses, and what their expected timeline is. A common introductory framework could include 3 sessions, but it usually takes 4 to 6. And then, of course, a formal reassessment. This is starting structure, not a universal prescription. It may be adapted to the patient, clinic policy, equipment, provider training, and applicable regulations. Measurement comes before more treatment. Always remember that. It responds. If response is limited, you have to reassess the working pattern, the scalp health, internal contributors, medication changes, and candidacy. Non-response is clinical information. It should not automatically treat another session. You have to pause and reevaluate.
So adjuncts, when to use stimulation, not repeated trauma. So adjuncts should should support biology without creating unnecessary repeated trauma to that area that we're treating. The principle is controlled stimulation, appropriate spacing of treatments, careful technique, and realistic expectations for both you and your patients during treatments. So microneedling creates a controlled micro-injury, small little micro-injuries, the dermal layers. But as a provider or technician using that, you have to consider the depth, the spacing, the scalp tolerance, infection prevention when you're doing the microneedling, any active inflammation on the scalp, and what's applied to the treated tissues post microneedling. The more aggressive microneedling is not going to mean automatically more aggressive follicle stimulation in a result, quicker result for the patients. It's just not. It's going to cause more trauma and not to that area. So light therapy is useful when a patient can follow a set schedule. A lot of the times we'll give patients devices to use at home, and we go over the schedule that they're going to use it at home, and we make sure that they're going to be able to put aside the time that is needed to get the most significant treatment out of that device. And if we're doing any kind of at home, we're always going over instructions with every kind of treatment. We're calling the follow-up, seeing how those patients are doing at home and while they're on that treatment, and consistent follow-up. Can't stress that enough when these patients are at home following your prescribed treatment plan for them. So topical or oral therapies can also be adjuncts when selected and monitored appropriately. Home care should remain simple enough to sustain for your patients. We don't make it completely unrealistic or complicated for the patients at home. It's very easy that they can follow day by day. So remember with this, excuse me, my computer keeps acting down. Controlled stimulation is not repeated trauma. Keep remembering that. If the scalp remains irritated and you're throwing all these treatments, throwing all these adjuncts at it, pause, because it's just going to get worse. Pause, reassess your patient, and if needed, like we stated earlier, just refer your patient if needed. So responsible biologic and consent language. Premium regenerative practice requires clear consent when it comes to consent language and regulatory adherence. Big regulatory adherence, because your state and your scope of practice could vary from other states. Each state scope of practice for providers and what they're allowed to do, even sometimes allowed to order from compounding pharmacies or specialty pharmacies, can vary. So make sure you're paying attention to that. Patients should understand that the working pattern, their rationale, any alternatives that they have to this treatment, the risks associated with the treatment, any limitations that they may have with this treatment during or after. A good timeline. Give your patients a realistic timeline of how long you expect that this treatment can last. But again, not offering any kind of faults or anything like that. The cost, that's a huge one. Most patients want to know what's the cost of it's going to be. And then measure that and have your baseline measurements, but measure the progress of your patients before you're even thinking about what you're going to start to do. Remember that. Appropriate language includes evidence is evolving. Don't use any kind of language such as "this will cure," "this is a permanent fix." Try to avoid language like that. That can get you in trouble with your state board of health. Don't kind of do anything like that. Results vary. Use that. Candidate selection matters. Progress will be measured. These are just those more examples of that language to use. And non-response will trigger a reassessment. That's also huge to use for patients. Inappropriate language, like I said, is going to be, "this is a permanent cure," or "this product works for every kind of type of hair loss, no matter what patient it is." No. It's individualized, first of all, and second of all, and that's not the truth. So make sure you're being very honest with your patients, which I know all of you are because you love what you do.
Mm-hmm.
So providers should be especially careful with exosome, stem cell, and other biologic claims, especially saying that stem cells cure this or stem cells fix this. You have to be careful when you're using that. Now, years and years ago, you used to have to go out of the country for stem cells. They were regulated by whatever country you went to as a medical oversight board. But now in the United States, they are not FDA approved for anything yet. But all of our compounding pharmacies, we specifically use one, but most of the compounding pharmacies are FDA regulated, meaning everything that is done in their lab meets the standards for quality, sterility, safety, and things like that through the Food and Drug Administration. So just keep in mind about using that language if you're doing any kind of stem cell, umbilical stem cell, exosome treatments. Avoid the language that's a permanent fix. Use make sure you're reviewing, current product status of any kind of new things you're bringing in, and educate your patients on these new products that you may be bringing in, because they're going to have questions, especially if you're getting into any kind of stem cell exosomes, because it's not known to a lot of people, unfortunately, and it's sad because it does wonders, but unfortunately not a lot of people know about stem cells in umbilical cord tissue. So a signed form when you're going over consent with all this is not enough to just create a real understanding of what is really going on with your patient. Make sure you're verbally going over everything with them. Make sure they really understand what their treatment plan is going to be.
Okay, case study, gradual male pattern hair loss. 47-year-old man has gradual frontal and vertex thinning, a strong family history, a healthy scalp, and visible miniaturization. The working pattern is non-scarring, intradegenic hair loss with viable follicles and no inflammatory red flags. Begin with the education and standardize, of course, their photos of the frontal hairline, temporal areas, mid-scalp, and vertex. Explain the goals may include slow progression, strengthening miniaturization hair, and improve visible density rather than fully restoring an earlier hairline. Topical A2M, minoxidil, whatever we choose to use at that time may be discussed as a foundation option. Qualified prescriber may discuss finasteride with individualized counseling about risks, benefits, and alternatives. PRP, stem cells may be added as a supportive regenerative component, followed by formal reassessment rather than automatic indefinite treatment. Light therapy can also be considered and is usually very good when it's realistic with some adherence. Each pod has a purpose. Medical and topical options address ongoing pattern loss. PRP supports the viable follicle, as does stem cells. And photography, of course, measures the changes. The best outcomes come from a coordinated system, not a syringe. So we want to sustain and measure those results. Sustain and measure the results protects outcomes, reputation, and long-term patient trust. At month 0, we identify the working pattern, do the photography, begin the appropriate intervention, establish the terrain plan. The patient should leave knowing the sequence and the next review point. During months 1 and 2, complete planned treatments while reviewing adherence, side effects, tolerance, scalp status, and new medical or medication changes. These visits are checkpoints. They're not just repeated procedures. Around month 3, formally compare the photos, review the shedding, examine the scalp, and decide whether to continue, modify, pause, or investigate further. Reduced shedding may be meaningful even before a major density change is visible. At month 6, review the overall outcome and create a maintenance plan. Limited response should trigger reassessment, not automatic treatment. Goal is not more sessions, it's better biology and a plan that continues to make clinical sense.
This goes over the standardized photography, standard practice. I hit this a bunch of times. Again, make sure you're doing photographs with your patients before and after with all your treatments. So this clinical decision algorithm turns Regen Rx, our framework, into more of a simple consultation flow. Begin with the history, the scalp exam, pattern, timeline, red flags. Then move over to any signs of scarring. If there is, red flag, pause, document, refer. If there's not, let's move on to our viable follicles. Define whether that candidate's a good fit and their baseline right then and there. And now we're going to go into our optimizing that terrain, that treatment. Get your labs, your history-driven plan, and anything like that. Then we're going to move right to treatment after we've hit all those. So that layered protocol with the reassessment. Explain what success looks like with your patients and what will happen when the response is limited. The practical anchor for this is do not sell the treatment until you have earned the working diagnosis and the candidacy for that patient is good and they're fit. So oops, sorry, go ahead.
Okay. Why protocols raise value? A strong clinical system creates the business stability without relying on the discounts or the sale pressure. Nobody wants to be sold, but they want to buy and they want results. Protocols improve retention. Measured outcomes can support referrals. Protocols also create team consistency. When the practice presents the protocol, the patient buys the leadership, the guidance, the explanation, the measurements, and the willingness to modify the plan. Ethical candidacy remains the foundation. The business becomes stronger and the clinical system is stronger.
Mhm.
The driver first framework used in hair restoration can also support facial rejuvenation and other areas of regenerative aesthetics. Of course, as we mentioned, we had 2 other master classes for the facial rejuvenation. Getting back to the scalp, we just, I beat this pretty much tonight. Distinguishing the diffuse shedding, the pattern loss, the traction, the inflammatory disease. We have to get a handle on all of that and identify the different drivers. In facial rejuvenation, we must distinguish volume loss, skin quality changes, muscular movement, the laxity, the edema, the structural support. Treating the wrong layer can create disappointing and unnatural results. The shared sequence for both of these, hair and the facial, is we assess, map, optimize, treat strategically, measure, and maintain. It doesn't mean hair and facial protocols are clinically identical. They're totally different, but we're using the shared sequence, all while creating this customized plan for the patients.
Breaking the objections. So as practitioners, you can find endless online information, PRP, microneedling, whatever, all these services. You can find it all cluttered online. So the problem is not accessing information. It's the scattered information creates a fragmented system. So one source teaches one thing, one source teaches the other. Regen Rx offers a coherent pathway, assessment, mapping, sequences, clinical judgment, implementation, and follow-up for you and your patients. It's an opportunity to observe one philosophy applied consistently from consultation through implementation. Concerns about time, cost, consider the cost of inconsistent consultations, poor retention, underpriced services, or purchasing tools without a clear pathway. That adds up quickly. The product invitation is for practitioners who want to move from isolated treatments to a protocol-driven practice. The message is aspirational, not critical. Organize and elevate the good care you providers already provide. It's that simple. So tonight, you were introduced to the Regen Rx framework, or advanced hair restoration, and we love that you were with us. Thank you. A whole person approach that combines regenerative medicine, aesthetics, and individualized treatment planning. We are excited that on August 29th, it's a Saturday, from 9 to 12, we will be taking this framework from theory into practice during an exclusive in-person Regen Rx experience. At this, you will observe the assessment and treatment of 3 live patients, including 2 physicians. One of these physicians is flying into Rhode Island specifically to experience the Regen Rx hair regeneration framework and receive treatments from one of New England's leading regenerative providers. Our 3 patients will have 2 women and 1 male. That way, because women and male are both very different when we're treating both of these. Have all previously received some regenerative or aesthetic treatments in other areas. So together, we're going to evaluate what they have tried in the past, identify any kind of treatment that may have been missing, and then demonstrate how their treatment plans can be advanced in the future using our Regen Rx philosophy. During the event, you'll observe 2 comprehensive facial rejuvenation and rebalancing protocols and treatments, you're going to see the treatments actually be done. And then 1 advanced hair restoration treatment. It's more than a procedural demonstration. You'll leave with 1 clear philosophy and 1 practical system that you can begin implementing in your own practice the very next Monday morning. So the in-person practitioner event is $6.99, available to live Masterclass attendees who register by Friday. You're going to get over $694 in bonuses. So it includes real patient training with the live consultations, some facial mapping, photography, implementation planning. It's not limited to just watching a procedure. You'll see how it's assessed, how treatment layers are identified, how the plan is sequenced, and how expectations are communicated. Just as this masterclass moved from the PRP sessions to a complete hair restoration system, The intensive moves from more of that isolated in-person. The intensive in-person moves from more of that isolated facial treatments to more in an assessment-based strategic planning. I hope everyone's sitting down. You've been with us for an hour, so I'm sure you are. Because for tonight only, my slide didn't make it there, but we are offering for tonight only, who sign up by Friday, to secure your seat for only $299. Surprised it wasn't there. Oh, there it is. For tonight's attendees only. Register for our in-person event on August 29th for only $299. So we're going to be putting a link in the chat window that you can use for registering. Seats are extremely limited, because what we're trying to do with this is preserving an intimate, hands-on learning experience. So it's going to be a small group, and we have a lot of people already very interested. So seats are limited. Please respond as quick as you can to reserve your seat. You can reserve today. We're most convenient way that you're able to pay. We take credit cards, Klarna, and other payment methods as well. But it's not about the payment and about the money. You're going to reserve your seat on August 29th, as we are going to bring Regen Rx framework to life and give you the philosophy, confidence, and practical tools to elevate the way you care for your patients and the way that you run your practice. And we look forward to welcoming you to our center on Saturday, August 29th, and look forward to seeing you then as well. Thank you for tonight.
If you have any questions, please put them in the chat.
Yes.
We are so excited to be giving back, and we are so excited to meeting each and every one of you. Thank you for attending the last 3 master classes. It has been our absolute pleasure. And like I said, we can't wait to meet all of you and teach you from our hearts to yours.
Yes, and thank you for everyone bearing with me through the technical difficulties.
Oh, so by the way, so just so you know, what will happen on the Saturday, we'll have a light breakfast at 9 a.m. We'll have our first patient coming 9:15, and it'll be amazing. What I love about the two, they're actually physicians, and that is such an honor when physicians come to get treated by me. But they have been veterans in my practice, and but they're coming in for different things, which is wonderful. But they'll be able to share their experience of their actual protocols and their journeys with all of you. So I'm very excited about that. And then the male one, so it'll be 9:15, 10:15, 11:15. And, we'll be respectful of your time. You'll learn a lot. And like Anthony said, you're going to be able to go back to your own practices on Monday morning with so much knowledge, information. Not only are you going to be able to make your patients happy, but this is for you as well. And this is for your professionalism and all of the hard work that you've done. You deserve to know how to implement protocols and keep and retain those patients. And that's core to what we really want to promote for all of you. And we're pretty excited about it.
Yes, we are.
So the date is going to be August 29th. It will be in our Cranston location. We have other locations, but the Cranston one would be the best. And again, it's only $299. It'll be from 9 a.m. to 12 p.m. Again, August 29th, which is a Saturday. We're looking forward to seeing all of you, each and every one of you, from our hearts to yours.
Yes, thank you so much for being here with us tonight. I know you guys are very busy with your own lives, practices, family, and we appreciate you taking the time out of your lives to come and be with us and learn. Hopefully you learned a lot tonight, but just to be with us.
All right. Thank you. I'd like to thank my entire staff, especially Anthony, who has co-hosted this with me tonight. And we're here for you. Any questions?
We are. Reach out to Regen Rx.
I want to give, because we know I'm not so technical. So, but I do think in the chat that link will work. But I do want to give you Rachel's phone number at our practice. Our main practice is 401-942-0600. Again, 401-942-0600 right here in Cranston, Rhode Island.